Hello. Today we need to talk about novel coronavirus, also known as COVID-19. I know many of you have questions, and I hope to answer at least some of your questions and help put your minds at ease. Let me start by saying, as of the time I'm filming this video, March 13th, we have had no known cases of COVID-19. We did have one individual in our care and custody tested, and the test returned negative. Experts are still learning about the range of illness from COVID-19. Reported cases have ranged from mild illness, like a common cold, to severe pneumonia that requires hospitalization. So far, deaths have been reported mainly in older adults who had other health conditions. While health experts are still learning the details about how this new coronavirus spreads, we are all encouraged to follow steps to prevent the spread of germs. Cover your mouth and nose when you cough or sneeze, and please don't cover them by using your hands. Cough or sneeze into your elbow. Wash your hands with soap and warm water. Keeping hands clean is one of the most important steps you can take to avoid getting sick and spreading germs to others. If soap and warm water are not available, use hand sanitizer, but soap and warm water really are the most effective way. You can see here how washing hands appropriately for 30 seconds significantly reduces the germs on your hands. We are also encouraged to maintain social distancing. Social distancing is a measure taken to minimize contact between people in order to contain the spread of a contagious illness. It is suggested that, to the extent possible, people maintain a 3 to 6 feet distance from one another to contain the spread of COVID-19. Now, in our work environment, that's difficult to manage, but we should be aware of social distancing and adhere to it when possible. Now, please, if you develop a fever over 100 with a cough and/or a sore throat, seek medical attention and stay home from work. We have made significant changes to our normal operations in response to COVID-19, and it is critical we take the appropriate precautions necessary to keep our employees, our contractors, volunteers, visitors, and the men and women in our care and custody safe and healthy. In doing this, we will help slow the spread of COVID-19 so that valuable resources such as hospital rooms, respirators, and the like are available to our vulnerable populations in prisons and throughout the state. Our first action was to suspend visiting in all 14 institutions. Please know this decision was not made without a lot of thought. As an agency, we value visiting and know it is critical in maintaining family connections. We understand the decision has significant impact on many people, including children. We have also suspended institution access to most contractors and all volunteers. This has caused some angst to us, AICs, and to those who provide valuable services to our agency through contract and volunteer work. We value these services they provide in reducing recidivism and in providing activities for our AICs. We want to assure you our regular security protocols are still in effect. Security staff will remain on post, and inside operations will be maintained as much as possible at this time. We have also decided to suspend AIC work crews except for central distribution, commissary, and OCE crews. Our community corrections teams in Lynn and Douglas counties have limited office visits and field work while continuing to maintain adequate supervision. Over the next 30 days, starting on March 13th, we will assess our situation and the precautions we've been able to get in place. And if we feel we can reinstate institution access while keeping people safe, we will do so. And I assure you, we will bring these services back as soon as possible because they benefit us all. We will continue collaborating with our local public health officials, coordinating with the Oregon Health Authority, and following the Centers for Disease Control and Prevention recommendations to prevent the spread of COVID-19. Many of you have a lot of HR-type questions, especially around leave usage. The Department of Administrative Services, DAS, is working hard to keep all state employees well informed. The best place to access up-to-date information is on the DAS website you see here on the screen. However, I do want to answer one question I have been asked now a number of times. Can a supervisor send me home from work? And the answer is yes. A supervisor will consult with their management team and human resources staff, and then may tell an employee to go home if they believe the employee is a health hazard to themselves or others. And you may be required to provide a release in order to return to work. If a supervisor sends an employee home, the agency will pay the employee for the remainder of the shift for that day. Afterwards, accrued leave is to be used according to policy or collective bargaining agreement. We will do our best to continue to keep you up to date on what is happening here at the Oregon Department of Corrections with COVID-19. Please help us slow down the spread of virus by doing your part. Until next time, be well and be safe.